Good morning. Today we have a 14-year-old patient. We are planning for a secondary alveolar bone grafting, secondary lip repair, and secondary nose correction, basically alar rim or getting a nostril symmetry. So today I'll talk about the secondary alveolar bone grafting. So in a unilateral or bilateral complete cleft lip and cleft palate cases, usually there is a defect in the alveolus or the tooth bearing area. We call it alveolus or we call it a gum. So there is a defect in the bone, and usually we don't repair bony defect during the primary surgery, like during a primary cleft lip repair and primary palatoplasty. We generally do alveolar bone grafting between the age of 8 to 10 years, which is the ideal scenario, but it can be done even at the later date also. So what happened because of the alveolar cleft? Usually there is a issue with teeth alignment. So because there is proper bone is not available for the teeth to come out in its normal place, they come at certain angles, or they may be crooked, they may be rotated, and we then later on needs the alignment. And because there is a defect in the bone, the alignment is not possible, so that is why we need to bone grafting surgery. So after we do a bone grafting surgery, the area is filled with the bone, and then with the help of braces we can align the teeth properly. There are certain other advantages also, like the upper jaw or the maxillary bone is usually in 2-piece or 3-piece in unilateral and bilateral cleft. So once we do the bone grafting surgery, the upper jaw bone becomes like a single unit, which will be very much helpful while doing corrective jaw surgery. The message for the cleft patient is that they should know the ideal timing for the bone grafting surgery, which is around 8 to 10 years of age, when the canine root is half formed. So your surgeon, your cleft surgeon, will guide you which is the ideal timing for the bone grafting surgery. Thank you.
वीडियो ओपन किया ना वीडियो ओपन किया ना